Some big changes are coming to Alberta's healthcare. The Alberta Health System Services says it is taking immediate steps to reduce costs at the administration level while redirecting dollars to high-priority areas. The AHS board has been meeting in Lethbridge and today revealed how it plans to deliver better services with less money than originally expected from the Alberta government in the recent budget. Among the immediate steps, a 3-year compensation freeze for 10,000 management, out-of-scope employees and physician leaders. There's also a hiring freeze for all non-critical administration positions. At the same time, AHS says it will hire more nurses and doctors in priority areas and invest more in primary and community care. Terry Boat reports.
Alberta Health Services says it knows the direction it needs to go and says there's no need to wait until the budget is approved before moving forward.
We don't look at it as 1.5% less. We look at it as a 3% increase. So it's all in the eyes of the beholder.
AHS Chair Stephen Lockwood says the goal is to get better quality and better value for dollars spent on health care. The plan calls for more community-focused service delivery, with local leaders having more authority. It also calls for saving $35 million over the next 3 years by reorganizing management, freezing compensation for 10,000 top-level staff, and a hiring freeze for all administration positions not considered to be mission-critical.
And we have a significant amount of duplication. I think it's pretty obvious to anyone who's had a business interaction with Alberta Health Services that it's a complex system. So I think there's, a lot of savings that can be made on the administrative side, and I'm also certain that that will improve the satisfaction that people have with the services we deliver.
Essentially what the government has done is boxed AHS in.
Friends of Medicare says it's concerned the 3% increase in provincial funding won't be enough to maintain current services, considering the AHS will soon be starting contract negotiations with nurses. But they're also concerned about broken promises when it comes to long-term care.
The expansion of long-term care is not something that we saw in the budget. It's not something that AHS is going to be able to do.
While critics may not agree, the Alberta Health Services Board says the upcoming budget shouldn't have any impact on employee safety or quality of care.
I think it's a reprofiling of how we deliver care. I don't expect the overall numbers of frontline workers to change very much in this. Where they're working may change substantially over the next 3 years, but the numbers should not.
Alberta Health Services says today's announcement was simply setting the stage, that more details will be announced in the months ahead. Terry Boat, CTV News, Lethbridge.
Now, Friends of Medicare is holding a public meeting tonight in Lethbridge to discuss their concerns with last week's provincial budget. The meeting gets underway 7 o'clock at the Galt Museum. And the cuts are already creating quite a buzz. These comments were posted on our CTV Lethbridge Facebook page. Sheila says, "I would love to see a salary rollback on MLAs, and other travel by air should then be by coach, not the more expensive business class." Megan wrote, "What I don't understand is why we continue to make cuts to services that are incredibly important to us, but we continue to pay over $300,000 a year to the people that are telling us to make these cuts that are required." And Logan added, "If you can save $10 million a year by not hiring and traveling alone, doesn't that say something?"